Fitzgerald here, doing with Dr. Deborah Bogan, Director of the County Health Department, here with our weekly update on the coronavirus pandemic. Obviously, the first weekend of summer that came last weekend with an awful lot of people going out. I want to, again, thank everybody for their cooperation and being responsible. As Dr. Bogan will talk about in a little bit, we've actually seen our numbers continue to maintain stable. And while, we're going to hear in a couple of days when the governor announces which counties are going from red to yellow to green, et cetera, we've now been in the yellow now almost 2 weeks, about 12 days. And again, the numbers have stayed relatively stable. We're very happy about that. And at a time in which we've increased the amount of testing throughout the county, which is obviously very important as we start to open more and more things up and people feel a little more comfortable going out and being in public. I also want to thank Dr. Bogan and really the health department team for really ramping up and adding the number of testing sites that are available throughout the county, particularly in some of our poorest communities that might not have access to those at our federally qualified health centers, which we could refer to as the FQHCs, a number of them. And I know this is something I worked with our elected officials, and I want to thank Representative Wheatley, Representative Gainey, Representative Davis, Representative Lee, Councilman Walton, Councilwoman Bennett, Councilman Burgess, and Councilman Lavelle, meeting with them to talk about some areas in their districts and their communities in which we want to make sure that that this testing is available. I know they were listed yesterday, but let me just very quickly go through that list. The Alma Ellery Medical Center in Homewood, the Braddock Family Health Center in Braddock, the East End Health Center, the East Liberty Health Center in East Liberty, Hazelwood Family Health Center in Hazelwood, the Hill House Health Center in the Hill District, McKeesport Family Health Center in McKeesport, Metro Community Health Center in Swissville, the Northside Christian Health Center over on the north side of Pittsburgh, the Northview Heights Clinic in the Northview Heights section of the city of Pittsburgh, Pittsburgh Mercy Family Health Center over in the south side of Pittsburgh, Squirrel Hill Health Center in the Squirrel Hill Homestead area on Bronze Hill Road in Greenfield area in the city of Pittsburgh, Steel Valley Family Health Center on West Street in Homestead, the Stowe Rocks Family Health Center in McKees Rocks, the West End Health Center on Neptune Street in the west end of the city of Pittsburgh, and the Wilkinsburg Health Center on Wallace Street in the borough of Wilkinsburg. So having these more robust and more accessible FQHCs will give people a little more confidence that they can have the type of testing that we want to make sure all people have access to out in the community. Again, we've been now over 2 months, almost 3 months that we've been in this kind of closed down, locked down, everybody kind of worried position. Continue to wear your masks, and we know, when the weather gets hot, it's a little more difficult sometimes. So try to get a cloth mask that would give you a little more cooling to be able to go outside. Obviously, continue to keep the physical distance that we can, and again, still be responsible. We're responsible for each other and all the folks that we have. And I know we're going to be taking some questions in a little bit about the green and about playgrounds and pools and retail and all the different things that people have been talking about for a number of months. So with that, let me turn it over to the director, Dr. Bogan, to give her update. Dr. Bogan.
Thank you, Rich, and good afternoon. Thanks for joining us again today. A few weeks ago, I shared with you some information about who is getting sick and where the county's new cases of COVID-19 are coming from. It's important to periodically share this information to illustrate the toll the virus is still having on our community. Between May 6th and May 20th, the latest 2 weeks for which the county has complete data, our staff started investigations on 278 new cases in our community. Of these, 14% are among healthcare workers, most of whom work in long-term care facilities. 41% are residents of long-term care facilities. About a third of the new cases are in people over the age of 70. And between May 6th and May 20th, there were no new cases reported at the county jail, and there were no new cases reported among police, EMS, firefighters, And in fact, nearly all of our first responders sickened during this pandemic have fully recovered. Among the new cases, 72% were linked to another known case. And we'll provide this information to detail for the reporters after the briefing. We are also watching hospitalizations closely. Since Allegheny County moved into the yellow phase on May 15th, there have been 34 new hospitalizations. As Mr. Fitzgerald said, our testing continues at our federally qualified health centers in Allegheny County. The health centers and community clinics have administered more than 400 tests from the Curative Lab in California, and we know the results for 304 of these, and 7 have come back positive. The FQHCs have added new testing sites during the last week. Testing is now available at about 20 sites. Be aware, though, that some of these sites are not active every day, so it's important to schedule your appointment. You can schedule an appointment by either visiting AlleghenyCovidTesting.com or by calling the nearest FQHC. And all that information is available on our COVID website at the County Health Department. The number of children in Allegheny County infected with COVID-19 remains low. We've had only 48 children age 18 or younger positive for COVID in our community. We are not aware of any cases of multiple inflammatory syndrome among children in our county, which is a great relief, but we are watching this closely. However, this isn't to say that children in the county aren't suffering. Kids, I know you're bored. You want to go swing on the playgrounds, hang out with your friends, play Little League, go to summer camp, swim in the pools. Gosh, you probably never thought that video games would become so boring, did you? And parents, you're doing a great job. I know it's tough having your children home full-time and in your homes without school and daycare. We're working hard to come up with ways to keep summer safe for everyone. We are pleased and excited that Governor Wolf last week released information for day camps to operate this summer. Camps are important sources of childcare to allow adults to go back to work. They provide hours of entertainment, learning, and relationship building for our children. But please follow the health and safety directions for these camps carefully and completely. It's going to be different than in past summers, but the guidelines are in place to keep everyone safe. Some pools around the county have already opened this summer, and more will do so. This is another great resource for fun and activities, but also another place that must be careful not to spread the virus. The number of people allowed in the pool is going to be less than what you're used to. This is done to allow for physical distancing, even in the water. Please follow the rules about how many people can be in the pool at the same time. You should not wear your mask while in the water, but you should have one to put on when you get out. A wet mask can make it hard to breathe, but a dry mask can protect the people around you. As of now, wading pools, spray pads, diving boards, and slides are going to be closed. These are areas where people are prone to congregate, where physical distancing may be tough to maintain, and where it can be difficult to clean and sanitize regularly. While organized sports won't likely start in Allegheny County until the green phase, there are many ways to practice and stay safe while staying outside and having fun. You can play catch with a football, baseball, frisbee, or whatever, with a couple of people. Just make sure not to touch your face while doing so and wash your hands well when you're done. You can pass a soccer ball or a deck hockey puck or a lacrosse ball back and forth. You can play tennis, although I encourage singles matches for now, or doubles with members of your household. Ride bikes with friends as long as you're staying 6 feet apart and washing up when you're done. We have to work together to get through this, and that means everyone, even you kids, have to do this as part of your jobs. I know I probably sound like a broken record, but the most important thing we can all do to keep each other safe is to wash our hands frequently, cover coughs and sneezes with our elbows, not our hands, clean frequently, touch surfaces regularly, and wear your mask over your nose and mouth. So stay safe, have fun, and remember it is summer, wear your sunscreen. All right, Rich. Thank you.
Thank you, Deborah.
The most popular question, as you might imagine, from multiple outlets is multiple questions related to the county pools and what the county may be doing in regards to opening them now that the guidance has changed.
Yeah, this is obviously when you have hot days like we've had over the last few days, a lot of people are concerned are pools going to be open. And I will tell you, up until Friday, we were anticipating that there wouldn't be an opening of pools. And, the state changed the guidelines on Friday, the Friday before Memorial Day, which obviously makes it challenging. I guess we're going to evaluate that at this point. It's going to be very difficult. One of the reasons is trying to have enough trained lifeguards. We have some very, very big pools and for the county parks. 3 big wave pools plus the other big pool in North Park. I think it might be the biggest pool in all of Western Pennsylvania. So it's going to be challenging, to say the least. Whether it can happen or not, we'll see. Even under the best of circumstances in non-COVID years, we always struggle to find enough lifeguards to be able to staff in the pools that are there. This will add a special challenges with the physical distancing, with locker rooms and snack bars and areas where people congregate, all those type of things. So we're going to look at it. We also know that that the county pools tend to be more of destination pools as opposed to neighborhood pools. So people usually plan that trip to go to a wave pool. It's more of an event as opposed to when you wake up and it's hot, you're just going to walk down to the neighborhood pool. So I know a number of municipalities are looking for guidance as well. I've been talking to Mayor Peduto and the city, and I know they'd be struggling the same way to try to do that. They have even more pools to deal with. So again, this was something that came about at the last minute, and we'll certainly continue to evaluate where we are, but I just don't think right now we're able to make an announcement one way or the other.
The second most popular question is in regards to whether you have any intel on when the county might go green, and if we do, what that might look like.
Well, I have no special intel, but just based on what happened when a number of counties went from yellow to green after 2 weeks of being in yellow, I feel that most of the southwestern Pennsylvania counties, including obviously Allegheny County, have kept our numbers very low. People have been very responsible, and as Dr. Bogan said, there's a lot more testing that's going on with the contact tracing, all those type of things. My sense is that we would probably get the designation to go into green a week later, which would open up some more businesses, some of our restaurants, some of our hair salons, nail salons, gyms, those type of things. But we'll find out in a couple days when the state releases their recommendations for all 67 counties.
This is a follow-up question to that from WESA. As we enter the warmer months, many of the public cooling centers, such as community centers, libraries, movie theaters, and pools are closed. Are there any recommendations or suggestions of how Allegheny County residents who lack air conditioning can stay safe and cool this summer? Yeah,
this will be a real challenge. And that's some of the things where we have to see if we do move into the green phase, what would that mean for things like community centers, libraries, other facilities that might be open, malls, where people tend to go at times, and then that would obviously include things like pools. So that's a challenge. It's a challenge that people who don't have access to air conditioning will have to deal with. But then we have to take a look at how many people will be showing up to those rooms, those crowded facilities, and would that be more of a health risk than being in the heat? It's one of those balances. We'll be working with our health department and with all the community centers to try to make people as safe as they can be.
This next question is for Dr. Bogan from WESA. The number of reported coronavirus cases last week, May 16th through the 22nd, was the highest it's been in the last 4 weeks. Is this due to increased testing, a backlog in testing results, or an increased number of infections?
Thanks for that question. So it appears, actually, when you look at the rate of positive tests, that is the number of positive cases over the total number of tested, that rate has stayed very stable for the last couple of weeks in our county, and it ranges from about 2 to 6%. On May 19th, we did have sort of an increase in testing on that day that may be giving that impression. We tested more than 800 people that day. and about 200 of those were from the Kane Center. So, but our positivity rate, if you look at that date too, did not rise. So the total number of cases may just reflect that more cases have been done, but again, the case positivity rate has not increased.
This question is from KDKA Television. I've heard the term slim chance used referring to the chance of anyone around the county outside a nursing home getting COVID-19. Do you think that's true?
Well, I think that the data we've shared today doesn't appear to be the case, right? Of the recent cases we've had, less than half are among residents of long-term care facilities, and about 10% are from healthcare workers. And that means the rest of the cases are from people in our community. And so I don't think that a slim chance is really a good way to say that. I think people are still at risk, and the general public needs to follow the same guidelines. Wear your mask, wash your hands, stay out of crowds, keep your physical distance. So I wish I could say that there was a slim chance, but I would not be confident in that.
This question from multiple outlets, and I believe you touched on these in your remarks, but the question is, have we seen an uptick of infections since Allegheny County transitioned to the yellow phase?
We have not really seen an uptick at this point, but we think it's probably still a little bit too soon. If there's going to be an increase, it takes on average about 5 days from exposure to show symptoms, and then a couple days before you get tested, and then a couple days for that test result to come back. So realistically, we won't know if there's an increase from reopening from about day 10 to 14. And again, we're really just at the beginning, at the front end of that estimate. So I sure hope that we don't have an increase. I do also think that we're very fortunate right now. The weather's nice. People are outside. I think it's less likely for you to get the infection when you're keeping your distance outdoors due to the sun, which we know reduces the duration of how long the virus lives on surfaces. We have wind and air movement. And again, people can physically distance better. So I think we are seeing some benefit from the fact that we can all be outside in this beautiful weather we've had for the last couple of weeks.
This next question is for the county executive. Pittsburgh is a finalist for the NHL Playoff Hub Cities. What is your reaction to that? Do you think this is good for the region? What preparations might be necessary if Pittsburgh wins the hub?
I do, and we've been in talks with the Penguins. They have what I think is a pretty solid plan. Obviously, this would be games that would be played without fans in the arena. But there would be a lot of precautions that would be in place for the teams that would be playing. Obviously, the NHL has decided they're going to move forward and have something in, I guess it's going to be in July. Pittsburgh would be one of the cities that would be considered. And I think one of the great reasons we would be is because of what's happened over the last 10 or 11 weeks, that we have kept our numbers low. We've got a very robust eds and meds system that's been in place for many, many years and certainly has been very helpful and productive throughout this pandemic. So I think there's a lot of good positivity that would come from this. I know the hotel industry would benefit for these teams that would be staying there. They've had a very difficult time, and I think, again, they've put some plans together that are, again, working with the Penguins, working with the community, working with our health officials to come up with procedures that would keep people safe. So I think it would be a good thing for Pittsburgh, and it's something I'm hopeful that we're able to get.
This next question is for Dr. Bogan. Is the county including antibody serology tests in its confirmed or probable case counts the same way the state is? And if so, can we start getting a breakout in the daily update?
So serology tests are included in our case counts as probable cases. However, the county only has access to positive results and not negative testing. And to date, there have only been 43 serology results reported to us through the NED system.
And this similar question, do you think antibody testing is an important part of allowing the county to open up, given the CDC's concerns of false positives with the antibody tests? Will having many people tested for antibodies be helpful or not?
So antibody testing is helpful in some situations. In a place like New York City, where there's been a lot of cases and the antibody test results are helpful because you have enough people to really use the antibody test can have some false positives, which means you test positive even though you weren't exposed to this particular coronavirus, but perhaps one of the coronaviruses that causes colds, and the common cold. And so in a place like Pittsburgh, where we've only had, we estimate, about 3% of our population that's gotten coronavirus, I don't think antibody testing is particularly helpful right now because the false positive rate can be as high as 5%. And so as time goes on, if we have more cases, it may become useful, but right now I'm not sure it's particularly useful here in our community, but maybe in other communities. And so we'll reevaluate that over time in our own community.
This next question is for the county executive and is coming from multiple outlets. Recently, a statement was issued by multiple parties indicating that an agreement has been reached with the county over steps to protect incarcerated people from COVID-19 at the Allegheny County Jail. Being asked if you have any response to that agreement.
It just came across, I guess, just this afternoon. To my knowledge, there are no known cases at the jail right now, and I want to credit the jail staff and the warden and his team for doing a very good job of protecting the folks in there. As this is ongoing litigation, I will have no comment at this time. No further comment at this time.
This next question is for Dr. Bogan. Dr. Bogan, you're a pediatrician. Can people in the yellow zone allow their children to have play dates? What circumstances would that be permitted in? And also, are you concerned how lack of interaction might be impacting kids' psychosocial development?
Yeah, that's a tough one. And again, I leave it to parents to make the best decisions they can for their children. I would say in general, again, small play groups, probably better than large play groups. Teaching children to wash their hands frequently, wear their face masks, playing outside, probably safer in terms of spread of the infection rather than playing inside. So I don't have any hard and fast rules. Parents really have to make their best judgments of that using the data of how we know viruses spread. And that is through droplets, so coughing, sneezing, talking loudly, yelling close by. The louder you speak, the more you spread the virus. And again, the more people you have playing together, the more likely you are to get the spread. So parents should use their best judgment and follow sort of the general guidance that we've given about the spread of the virus.
This question is also for Dr. Bogan. As the data shows, Glen Hazel Kane remains the only one of the county's 4 nursing homes with a true outbreak. Has the county or the health department studied what happened differently at Glen Hazel that didn't happen at the other 3 homes that may have led to the outbreak among both residents and staff? And if not, does the county plan to?
I think that's a really important question, and I don't have an answer for you today on that. We are looking at that and trying to see if we can come up with an explanation.
And a follow-up question related to the Pittsburgh being a finalist for the NHL Playoff Hub Cities. They want to know, is the county is prepared from a public health standpoint to host the NHL Playoffs? Again, each organization and every business has put together their plans based on guidance from the CDC and from the state. And I am absolutely positive that the NHL has read all those guidances and will follow them closely to keep their players safe. And this final question is for the county executive. The Elections Division reported that over 280,000 people applied for mail-in or absentee ballots, which seems to indicate that that effort was extremely successful. What's your response to that, and what do you think it means for the average voter on Election Day?
Well, I think it's just one more process that we all go through on a daily basis, that the folks in this region and this community have taken the expert advice of our medical experts and urged people on this process to vote by mail. The interesting thing on this election, we typically would see about 160,000 people who vote in the presidential primary in a year in which neither party has a challenge at this point. And thus far, as you indicated, over 280,000 people have applied for an absentee or mail-in ballot. So that's an incredible increase, and that's before folks will be going to the polls on Election Day. The polls are open. People can go vote in person if that's their preference, but our estimation is it'll be a very small percentage of people who take that risk, and not only for the voters themselves who have to go out, but those poll workers who are there to check you in and process and work those 13 hours, and we appreciate the great work that they're doing. And let me also just conclude by saying that the level of cooperation across all sectors, we've been in the yellow now for 12 days, so retail has opened up, offices have opened up, but we do see people taking the advice of continuing to wear their masks, continuing to physical distance, telework, work at home where they can, and we need to continue that. If we do get into the green in a couple of days, that doesn't mean we can relax and not do the things that we know that we've been advised need to continue. The distancing, the wearing the mask, washing the hands, all the things that we've been hearing about for the last few months, and we want to continue to do that. We can continue to keep people safe if we continue to be responsible and do the right thing, but we can also allow people to go back to work, businesses to start to thrive again, and our economy to open up to be what we've know Pittsburgh to be. And all the other activities, certainly as the summer months, as Dr. Bogan talked about, people want to get out and recreate and enjoy the beautiful weather that we're known for here in Western Pennsylvania. So again, let's keep our fingers crossed, keep doing the right thing. Thank everybody for their great level of cooperation, and let's continue along those lines. God bless.